music hold ended.
Hello, I am AARP Senior Vice President Bill Walsh, and I'd like to welcome you to this important conversation with Dr. Mandy Cohen, the Director of the Centers for Disease Control and Prevention. Dr. Cohen will discuss the latest on what you need to know about vaccines this fall and winter and answer your questions live. Before we begin, if you'd like to hear this telephone town hall in Spanish, press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione asterisco y 0 en su teléfono ahora.
AARP, a non-profit, non-partisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. Through events like this, AARP continues to provide information and resources to help older adults and those caring for them. As we head into the cooler fall and winter months, and COVID is resurgent in some areas, the importance of timely vaccination decisions becomes increasingly vital for older adults. With heightened health risks and the potential for extended hospital stays due to respiratory illnesses like flu, RSV, and COVID-19, understanding the facts and taking action are crucial. That's why we're here today. We're joined by Mandy Cohen, MD and Master in Public Health, and the Director of the CDC, whose mission is to protect America from health, safety, and security threats, both foreign and in the United States. Dr. Cohen will provide the latest on vaccine recommendations and strategies to protect yourself against respiratory illnesses and other threats. If you've participated in one of our Tele-Town halls in the past, you know this is similar to a radio talk show, and you have the opportunity to ask your questions live. For those of you joining us on the phone, if you'd like to ask a question, press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in the queue to ask your question live. If you're joining on Facebook or YouTube, you can post your question in the comments. Hello, if you're just joining, I'm Bill Walsh with AARP, and I want to welcome you to this important discussion on public health and vaccine awareness. Today we're joined by Dr. Mandy Cohen, the Director of the Centers for Disease Control and Prevention, who will provide valuable insights on vaccinations and protecting your health as we approach the cooler months. This event is being recorded, and you can access the recording at aarp.org/conversations 24 hours after we wrap up. Again, to ask your question, please press *3 at any time on your telephone keypad to be connected with an AARP staff member. Or if you're joining on Facebook or YouTube, go ahead and place your question in the comments section. Now I'd like to welcome our special guest. Dr. Mandy Cohen serves as the Director of the Centers for Disease Control and Prevention. An internist by training, Dr. Cohen leads the nation's efforts in public health, including vaccine recommendations and strategies to combat prevalent health risks. Welcome back to our program, Dr. Cohen.
Hello. Bill, thank you so much for having me. Look forward to the conversation today.
All right. We're delighted to have you. And just a reminder to our listeners to ask your question to Dr. Cohen, please press *3 on your telephone keypad or drop it into the comments on Facebook or YouTube. Let's get right to it. Dr. Cohen, I know our listeners are eager to hear from you about vaccines, but before going there, can you please set the scene for us? What are the trends you're seeing in respiratory illnesses such as flu, COVID, RSV, and how risky are they for older adults?
Well, I'm glad we're talking today about preparing for the upcoming fall and winter respiratory virus season. And what our updated recommendations for vaccine are for this year. But even before we get to the fall and winter, we know that there is COVID circulating right now. We saw an increase in COVID over the summer. It is coming down again, but it just reminds us that COVID is here with us and we need to use the tools that we have to protect ourselves. We've simplified our guidance, really focusing on vaccines because that is what we know works to protect us and keep us out of the hospital and unfortunately losing our lives to these viruses. Every year, flu, COVID, and RSV cause hundreds of thousands of hospitalizations and deaths, and it's particularly high in the fall and winter months. That's why it's a good thing we're talking today about getting prepared. We particularly know older adults over the age of 65 are 9 times more likely to get really sick from these respiratory viruses and need hospital care. So it's really important for our older adults over 65 to make sure they're doing everything they can to protect themselves going into the fall and winter.
Okay, thanks for that. You mentioned COVID, of course, and the resurgence we've seen recently. Updated vaccines from Moderna and Pfizer were approved by the FDA last month, and the CDC has recommended everyone 6 months and older get an updated COVID vaccine this fall. Can you discuss that recommendation, and does the new COVID vaccine protect against the current and future variants?
So, great question. We have updated the COVID vaccine for this fall and winter to match the changes in the virus we have seen over the course of the year. So you want to get the updated version of the COVID shot, which is now available. And actually, there are 3 options, a Pfizer, Moderna, as well as a Novavax vaccine. Any one of them is good. There is no preference, just getting the vaccine and making your plan now to get that shot. This new vaccine, the updated one, gives you the best protection from the current version of the virus that is circulating. We know the vaccine can cut your risk of getting really sick by about half. And it reduces things like long COVID by about half as well. So not only would you not get sick, but it cuts your risk of getting long COVID as well.
What about the cost? Does Medicare cover the new vaccines? And what about folks who are in private health insurance plans?
Medicare does cover the cost of the COVID vaccine as well as flu and RSV. They are covered under the Medicare Part B program, and there is no cost to individuals who are covered by Medicare. Generally, all of our private insurers are covering all 3 vaccines as well. For those who may not be covered by insurance, be sure to be in touch with your public health department or a community health center. We just released additional dollars and funding so they could be able to purchase vaccines and offer them for free as well.
Okay, very good. Now, you mentioned that there are 3 vaccines out there now, Moderna, Pfizer, and the Novavax. Can you help us sort through them? What's different among them, and what's different this year among the vaccines designed to treat the latest strain of COVID?
Sure. For COVID, this year, like I said, has been updated to better match the COVID virus that we are seeing circulating. And we recommend everyone over 6 months get that, and particularly those over 65, really make sure you're making a plan. As I said, 3 different brands, Pfizer, Moderna, Novavax, but no preference over one or the other. They all provide that protection against serious consequences of COVID. It's just important to get a vaccine, get whatever one is easiest and most convenient for you. I do want to mention there's an updated flu shot as well for the season. Certainly recommend that as well for everyone over 6 months, particularly for those over 65. And we want you to talk with your doctor or pharmacist about the high dose flu vaccine or the adjuvant flu vaccine if you are over 65. And Bill, last is RSV. We do have some updated recommendations around the RSV vaccine. We recommend 1 dose of the vaccine for everyone over 75. Previously, I think it was a little confusing what the recommendations were, so we made it real simple. So if you're over 75, you should get 1 dose of the RSV vaccine. It's not annual like the COVID and flu. So if you got it last year, you're good. But if you haven't gotten an RSV vaccine and you're over 75, you want to plan to get that as well. Additionally, if you're between 60 and 74, but are at increased risk, you have heart disease or lung disease or a weakened immune system, we also recommend you get 1 dose of that RSV vaccine as well.
Okay, so it sounds like with RSV, it's one and done. What's the risk of skipping that vaccine?
Well, RSV can be dangerous for older adults, especially those who have certain medical conditions or are living in a nursing home or are very frail. So if you are living in long-term care or a loved one is in long-term care, you specifically really want to pay attention to RSV. And getting that RSV vaccine can cut your chance of getting really sick. And again, it cuts that risk generally in half. And skipping the RSV vaccine can put you at risk for a severe form of RSV and can worsen underlying lung disease like asthma or COPD or even something like heart failure. So the RSV vaccine is important to get, and we want everyone 75 and older to get one dose. And if you're 60 to 74 and you have lung disease or diabetes or weakened immune system, to get that as well.
Okay.
And Bill, it's one and done for now. We're still looking at the data to understand if we'll need booster in the future. So stay tuned. But for this year, it's one dose. So if you got it last year, you're good. And if you haven't, make sure to get it this year.
And is that vaccine covered by Medicare as well?
Again, yes, RSV vaccines covered under Medicare Part D.
Now, you mentioned flu vaccine just a moment ago. I wonder if there's an optimal time to get the flu vaccine. And we know that there are three flu vaccines available to older adults. Can you talk us through that a little bit and figure out which one is right for which people, which populations?
Yeah, the best time to get your flu shot is honestly right now. So September and October, those are the ideal months to get vaccinated, both with COVID and the flu shot. It allows you to get the vaccine, build up some antibodies as we go into what we know will be higher season. So make that plan now. These are the ideal months. Again, we see most of the hospitalizations and deaths from those two viruses in the winter months. So you want to make sure you're getting that up ahead. As far as the three different flu vaccines, I think the thing to remember is talk to your pharmacist, talk to your doctor or nurse practitioner or other clinician. And we recommend using the higher dose of the vaccine. So you want to talk with your doctor or pharmacist to say, hey, what higher dose of the flu vaccine is best for me? Is it the high dose or the adjuvanted? So we want to make sure one of those is the one, if you're over 65, that you are choosing.
Okay, very good. Now, can multiple vaccines be administered at the same time?
Great question, Bill. Yes, multiple vaccines can be given at the same time. So we want to do what's easy for you. So if it's harder for you to get to your doctor or your pharmacist, definitely okay to get COVID and flu vaccines on the same day. My recommendation would be always to talk to your doctor, to your pharmacist about what's best choice for you, but absolutely okay to get them on the same day.
Okay, fantastic. You've given us a lot of great information. Let's go to our listeners and hear what they have to say. It's time to address your questions with CDC Director Dr. Mandy Cohen. As a reminder, press star 3 at any time on your telephone keypad to be connected with an AARP staff member and share your question live. And if you'd like to listen in Spanish, press star 0 on your telephone keypad now.
Si usted desea escuchar en español, presione asterisco y 0 en su teléfono ahora.
All right, I'd like to now bring in my AARP colleague, Shani Hostin, to help facilitate your calls today. Welcome, Shani.
Thanks, Bill. I'm happy to be here for this important conversation today.
All right, who do we have first on the line?
So, Bill, today we have Elizabeth from New Jersey.
All right, welcome to the show, Elizabeth. Go ahead with your question for Dr. Cohen.
Okay, my question is, I just finished 6 weeks of radiation and chemo pills as well as the chemo in the vein in the beginning for cancer. I haven't gotten the results back. They're supposed to come sometime this month. This month I'll get the results. Is it safe for me to take the COVID shot? Because they said my immune system would be down.
Dr. Cohen?
Yes, well, Elizabeth, sounds like dealing with a lot of going on right now, so I hope you're doing well. Wishing you a speedy recovery. But yes, it is still okay to get your vaccine. And in fact, because your immune system is a bit down, even more important for you to get those vaccines. You'll want to talk to your doctors about whether or not you will need a booster. You may need a second additional dose in a sooner time frame. We make recommendations on getting a second dose, but you definitely want to go get those first doses, and now is a good time to do that in the September-October time frame. Get both that COVID and flu shot. I would encourage, if you are over the age of 60, it sounds like you do have one of those risk factors I was talking about, so I would get an RSV vaccine as well.
Okay, very good. Shani, who's up next?
Next, Bill, we have Rosia from Rochester, New York.
Hey, Rosia, welcome to the program. Go ahead with your question. Hi, go ahead with your question. All right, well, let's move to the next caller.
Okay, let's move to Janice from Virginia.
Hey, Janice, welcome to our program. Go ahead with your question. Oh, all right, let's try another one.
Let's go to Mary Ann from Connecticut, Meriden, Connecticut.
Hey, Mary Ann, are you with us?
I'm still here.
Oh, very good. Thanks for hanging with us.
Looks like you did such a great job of answering that first segment there. That answered a lot of my questions, too. But
well, I hope you have one question left for Dr. Cohen. Go ahead.
Okay. Mine, I'm going to move ahead to the RSV. I don't know if I've ever had that. I'm 85 and a half. And I know which of the flu ones I have to get. The RSV is something I should also be getting?
Dr. Cohen?
Great, Marianne. Terrific question. Yes, you should be getting, we would recommend an RSV vaccine for you. That this is a newer vaccine. It's only been out for about a year. So if you don't remember getting an RSV vaccine within the last year, you should plan to get one in the next couple of months ahead of the RSV season. It's one dose. Talk with your doctor or pharmacist about it. And if you are over 75, we recommend everyone get it. If you are between 60 and 74 but have diabetes or heart disease or lung disease, we recommend it as well.
Okay, very good. Thanks very much. Shani, let's take another call.
Okay, let's go to Linda from Belmont, Vermont.
Hey, Linda, how are you? Welcome to our program.
I was diagnosed with COVID this week, ironically, and I'm wondering how soon is it safe for me to take the vaccine? And I also, a couple weeks back, I was diagnosed with psoriasis of the scalp, and my understanding it's, and I think it's called an immunosuppressant disease or something of that nature. Please forgive me for lack of a better term, but I was wondering how that might be impacted by the vaccine.
Okay, thanks for the question. Dr. Cohen, can you address Linda's question? She has COVID now. How should she proceed?
Yeah, well, Linda, first, hope you feel better soon. It's a good opportunity to mention, we've been talking a lot about vaccine, but no, we also have treatment for COVID. It's a reason why I'm glad you got tested. You know you have COVID because the treatment called Paxlovid is something you want to take early on. That could save your life as well. Paxlovid really cuts down risk of particularly older adults going into the hospital. But sounds like you're on the upswing, which is good. You can get your updated COVID shot in 3 months. So 3 months from now, I would get the updated COVID vaccine. Now, because you mentioned you have a new diagnosis of something that is making your immune system suppressed. Right. So when you are having something that makes you have a lower immune system, it makes it even more important to get a vaccine. But it also means you are likely going to need a booster, a second dose of that vaccine, and talk to your doctor about what the right interval is for you. Usually we want to do it, again, within 6 months of getting that first vaccine, but sometimes we'll do it even sooner depending on your particular medical situation. Again, important to talk to your doctor about it, but when you have something that suppresses or decreases your immune system, more important to get vaccinated, and you might need additional doses in order for the vaccine to fully do its job.
Okay, very good. Shani, let's take another question.
Okay, great. I got a question here from John from New York.
Hey, John, welcome to our program. Go ahead with your question for Dr. Cohen. John, are you with us?
Yes, I am.
All right. Go ahead with your question.
My question is, my doctor told me to get a COVID shot in early July and to go ahead and get the new COVID and flu shot when it came out. Can I do it that soon?
That's a good one. Dr. Cohen?
Yeah, John, great question. Obviously, your doctor knows you well. I recommend going back and making sure, but yes, potentially based on what your underlying medical conditions, yes, getting another dose of the vaccine in the next couple of months might be the right choice for you. Again, not knowing all of your medical history, but it sounds like maybe you have a lower immune system and your doctor is thinking ahead about making sure you have an additional booster in there. So again, talk with he or she about your personal situation, but it is okay. It says July, so I'd say 3 months from the last time that you had a vaccine is appropriate. And again, based on your underlying medical conditions, you may want to think about maybe not in September, maybe thinking about October. That way you're spacing it out just a little bit more. But yes, getting the updated one in the maybe October timeframe sounds right.
Okay, thank you very much for that. Shani, let's take another caller.
Okay, great, Bill. We have Patricia from Chicago.
Hey, Patricia, welcome to our program.
Yes, hi.
Hi, go ahead with your question.
Yeah, I've had all my COVID shots. I never got the RSV because I just heard such horror stories about people being sick for a whole month or so. I will get the COVID shot, but I wonder what the side effects for this COVID shot are.
Okay, Dr. Cohen?
Great. Thanks, Patricia. Well, love that you're getting all of your updated, vaccines. The most common thing that we hear from folks about side effects from the vaccine is certainly some pain at the site of getting the vaccine. Other times we hear people feeling a little achy, maybe very low grade fever, like 99 or 100 in terms of a fever. That means your body is learning, right? What vaccines help us do is help our body get prepared to learn. And so when you can feel a little tired or you're feeling more achy, that's your body responding to the vaccine. Usually that lasts within 24 hours. You can take something like Tylenol or ibuprofen to relieve some of those symptoms. But those are the most common. Similar kinds of side effects for RSV vaccine. We haven't seen anything different in terms of the RSV vaccine side effects that we see with our flu and our COVID vaccine. Again, most common is something at the site and maybe 24 hours of feeling a bit tired, maybe a little achy.
Okay, thanks very much. Let's take another call.
Okay, great. We have Phyllis from Pennsylvania.
Hey, Phyllis, welcome to our program. Go ahead with your question.
Hi, I'm just curious about something. Everybody's immune system is different, but I've had friends who were very unhealthy, never having COVID. And I have friends who are very healthy, and they have had COVID 1, 2, or 3 times. How can that be?
Phyllis, what a great question, and the million-dollar question, or maybe billion-dollar question, if you will, right? And I think you started with it right, being like we all have different kinds of immune systems. Our genetics, our environment, our underlying other medical conditions, all contribute to how our immune system may interact. And certain folks, particularly if you're healthier, you tend to potentially do activities where there are more people. Maybe you're doing more traveling because your health is good, or you're out and about in more crowded situations. Again, that just might be a reason why some folks are getting it more than others. But, there's so many reasons. You can't really put one on. But I think it is something that's showing us that we have more research and more work to do to understand why some people who are really healthy can get COVID and get really sick.
Okay. Sounds like we lost Dr. Cohen's voice there for 1 second. We'll get her back in just a moment. I want to thank our listeners for all those questions. We're going to take more of... Dr. Cohen, are you back with us?
Oh, I'm sorry. I didn't realize you lost me.
Yeah, I just lost you for a sec. Do you want to wrap up your answer to Phyllis?
Oh, I would say, Phyllis, I thought it was a good question. We don't know the full answer, but what I would say is use the tools we have to protect yourself. Even those who feel really healthy, you want to take the COVID vaccine, the flu shot, but also use other tools to protect yourself, whether that's masks, ventilation, washing hands, avoiding some of the high crowded situations, particularly when COVID and flu are at their worst.
Okay, thanks very much for that. As I said, I want to thank all our listeners for those questions. We're going to take more of your questions shortly. Right now, I'd like to take a moment and share a quick advocacy update in a segment we call Fighting for You. Joining us here today is AARP Vice President Megan O'Reilly. Welcome to the show, Megan.
Hi, Bill. Happy to be here.
All right. Happy to have you. AARP recently led the way for historic prescription drug price reform in Medicare. Why is this so important?
So the number one reason seniors skip or ration their prescriptions is because they simply can't afford them. Americans pay more for the same prescription drugs than any other country on earth. This is unacceptable. And that's why AARP has fought for decades to lower prescription drug prices, and we're finally seeing progress.
Okay. Well, just last week, AARP released a new report detailing some of these Medicare savings. What were the findings?
We found some good news. A new annual out-of-pocket prescription drug cap is coming, and more than 3 million older Americans will see savings in 2025. Historically, Medicare Part D plans did not have a limit on out-of-pocket spending, but a brand new $2,000 cap goes into effect January 1st, 2025. Medicare drug plan enrollees who reach the new cap could see an average savings of about $1,100 in 2025 for their prescription drugs. That's $1,100 people can keep in their own pocket.
That's awesome. Are there other savings that seniors are seeing as a result of AARP fighting for them?
Absolutely. Now in effect, insulin costs for Medicare beneficiaries are limited to $35 a month. And as we talked about today, most recommended vaccines are available at no cost, such as for COVID and shingles. And in another big victory, Medicare now has the power to negotiate for lower drug prices on certain high-cost prescription drugs. The negotiated prices for that first set of 10 drugs selected by Medicare will take effect in 2026 and are expected to save Part D enrollees $1.5 billion in out-of-pocket expenses in the first year alone.
All right. That's great news. Megan, if listeners want to stay on top of AARP advocacy news, how can they find the latest updates?
We need to continue our progress, and I urge everyone to join the fight. Become an advocate or a volunteer. Call your AARP state office or go online to aarp.org/get involved and sign up for our free advocacy newsletter.
Okay, that's aarp.org/get involved. That's great information, Megan. Thanks so much for joining us today.
Thank you.
All right. Let's get back to our conversation with CDC Director Dr. Mandy Cohen. And as a reminder to our listeners, if you'd like to ask a question live on the air, please press *3 on your telephone keypad at any time. Dr. Cohen, moments ago, the CDC released a comprehensive overview of prescription drug use among older adults. In the report, CDC researchers found some older adults do not take medications as prescribed due to cost and may skip doses, take less medication, or delay a refill. How risky is it for them to adjust prescription drug use on their own?
Well, that is heartbreaking to hear because we want folks to be taking the medicine as prescribed. Otherwise, they don't work. It means that it won't be protecting your health. And we want to make sure that you're doing everything to be as healthy as possible. So we want you to take that medicine as prescribed. And as we're hearing that there is some help on the way in terms of prescription drug costs. And I'd encourage you, if you're still struggling with your cost of your medication, talk to your pharmacist, talk to your doctor's office, and see if there are other opportunities that they can work with you on to see if there are other options or programs for reduced cost drugs.
Okay, thanks very much for that. I'd like to turn to the issue of health misinformation. You know, we saw a lot of it during the COVID-19 pandemic. And news reports show that health misinformation persists. How does misinformation muddy people's views of the vaccine?
Well, vaccines have been our greatest tool at combating diseases like polio and measles. I bet many of you listening right now could remember a friend, a family member who had some of these very serious diseases like polio, smallpox, measles. But vaccines have been such a really important tool. However, misinformation can make it difficult for folks to make informed decisions about their health. And particularly it's concerning because it can lead people to reject accurate information. It's important to know where your information is coming from. A good source of information is the CDC. You can go to cdc.gov. It is a completely revamped website, easier to use, clearer information. And of course, talk with your clinician, your doctor or a nurse or a pharmacist about the information you may have heard to make sure that it is accurate.
It seems like the misinformation can really undermine trust in official sources like the CDC. What's the risk of this distrust across government agencies?
Well, I'm worried that we will take steps back from all of the progress we've made in terms of improving health in our country. For years and years, our life trajectory, our life expectancy, how many years someone would live has been going up and up and up. And that is because we are using the science and the data and the tools like vaccines to continue to protect health. And I worry if we take steps away from that, that we will see more people losing their life earlier. And we want to make sure that we are keeping you, your family, your loved ones, your community healthy.
I mean, despite all of the data and science that's out there, we know that vaccine hesitancy is real. And I wonder if you have any advice for our listeners about how to address it with someone you care about. What do they need to hear?
Well, first, I think it has to be a dialogue. It's a conversation and not a moment in time. And I'd encourage folks to start a conversation, listen to concerns, and help that person, whether it's yourself or a loved one, to find accurate, good information and a trusted voice where they can share their concerns and be able to get answers to questions. You know, for me, when I have met someone who may be hesitant to take a vaccine, I share my personal experience, what I've done for me, but also what I've done for my two daughters who are 10 and 12, what I recommend for my own parents, sometimes making it personal about what you would do and your motivation, meaning that you want to see that other person be well and live a long time, and share what you're doing can open the door for a conversation.
Okay, thanks very much for that. Well, let's take some more questions. It's now time to address your questions for CDC Director Dr. Mandy Cohen. As a reminder, please press *3 on your telephone keypad to be connected with an AARP staff member to get in the queue to ask your question live. Shani, who do we have on the line now?
Thanks, Bill. Let's go to Charlie from New York.
Hey, Charlie, welcome to our program. Go ahead with your question.
Yeah, hi. Hi. Earlier, the doctor mentioned that you could take the COVID and the flu shot together. But my question is, can you also take the RSV with the COVID and flu shot?
Good question. Dr. Cohen?
Hi, Charlie. Great question. So, yes, taking those vaccines on the same day is possible. You want to talk to your doctor about adding additional ones. Certainly can take COVID and flu on the same day. We would rather get you, if you know that it's hard for you to get to the doctor's office or get to the pharmacist, okay to add more on, but talk to the pharmacist about your options. So it is okay to get those on the same day, but talk to them about adding more beyond COVID and flu on the same day. Because, again, we want our bodies to be able to have the ability to learn, to react to those vaccines, build up the antibodies. So COVID and flu on the same day is good. Can add RSV, but have a conversation with your doctor or your pharmacist.
Okay, let's take another question. Shani?
Okay, great. Let's go to Devin in Chicago, Illinois.
Hey, Devin, welcome to the program. Go ahead with your question.
Hi, my name is Devin Tripp, and I'm in Chicago. I'm 66. By God's grace, I'll be turning 67 this month on the 13th. And I was just newly diagnosed with malignant breast cancer. I have heart failure, COPD, asthma, and I've had 3 strokes, 3 heart attacks with stent. And I'm just wondering what shots should I be getting. I'm due for an MRI of the brain tomorrow. And I have one son that's 30, and he has autism, PTSD, major depression. He has heart, lung, and brain. The other one is 33. He has epilepsy, heart, lung, and brain. And we try to get our shots at the same time, but since I'm taking the anastrozole ATR2, I'm in stage 1 of breast cancer. What shots should I be taking?
Yeah. Well, Devon, I'm so sorry. It sounds like you've really got your hands full. Dr. Cohen, what advice do you have for Devon?
Yeah, Devon, I'm so sorry to hear a lot going on medically. It's always my first recommendation is talking to a pharmacist, to your doctor, because I don't know all the medicines you're taking. But I particularly recommend vaccines to protect you when your body is trying so hard to fight things like cancer. It does make your immune system, it makes it less active, and so you want things like vaccines to be able to be to help you fight off some of these viruses. So I would recommend an updated COVID vaccine, an updated flu shot. I would talk to your doctor also about the RSV vaccine. And then there are others like shingles, pneumovax. So there are a lot of things that can protect you. You're going to want to talk about spacing them out. Again, I wouldn't do all of those on one day, but talk about getting them over a period of weeks. But again, first thing to do, talk with doctor or nurse practitioner or pharmacist, because I don't know all the medicines you're taking. But when you have a depressed immune system or a lower immune system, you do want to take advantage of all of those different kinds of vaccines to make sure you can get as much protection into your body as possible, particularly as we go into the winter months.
Okay, thank you. And Devon, thanks for that question. We'll be thinking about you. Who do we have on the line next, Shani?
So we have Vincent from New Windsor, New York.
Okay. Hey, Vincent, welcome to our program. Go ahead with your question.
Yeah, thank you. I got a polio shot when I was about 6 years old. It was the Salk vaccine, the very first batch that was introduced. Now, one county away from where I live, there have been some cases of polio because some sewer water or something, and people got, I don't know, but they were getting polio, just a few cases. But I've been hearing about it on the news, and I'm wondering if that old Salk vaccine is still effective, or is it you think, to be, safe? Because I don't want to get polio, that's for sure. Do I need to re-get the vaccine?
Right. Vince,
and I've asked my doctor. They don't even know.
They don't know.
No answer.
Well, let's see what Dr. Cohen says. Dr. Cohen, do you have an answer for Vincent?
Well, first, Vince, thank you and your family for being early adopters of the polio vaccine. That is something where the polio virus is different than, say, a COVID or a flu, where those COVID and flu viruses are changing. The polio virus has been very stable, has not changed in many years. So that is why one dose or the original doses of polio vaccine that you got early on in your life can still be protective now. That being said, we're also seeing very, very rare cases of polio here in the country, and in fact, have not seen polio in this calendar year. So not the thing that I am most worried about for you, Vince. I would say getting that updated COVID shot, flu shot, RSV, those are the ones that I would particularly focus on. If you're still worried about it and you're hearing that in your area, there is an ability for you to check your titers of polio, meaning that they can check your antibody levels for polio to see if that can give you an answer. But again, because of the type of vaccine you got, we might not know exactly what are the right levels, but that would be one option for your doctor to potentially understand how many antibodies to polio you might still have in your body right now.
Okay, thanks very much for that. Shani, who do we have up next?
Well, we have Diana from Vermont.
Hey, Diana, welcome to our program. Go ahead with your question for Dr. Cohen. Diana, you with us? All right, let's go to somebody else. Who do we have up next, Shani?
Well, let's go to Carol from Pennsylvania.
All right, Carol, you with us? Striking out on Carol today.
Carol, are you there?
I'm here.
Oh, okay. Carol, welcome to the program. Go ahead with your question.
Well, like I said, I got my COVID shots not last year, the year before, and I ended up getting COVID very bad and ended up in the hospital. Is it safe? Am I going to go through this again, God forbid, if I get my shots?
Okay, Dr. Cohen?
Oh, Carol, I'm so sorry to hear that. Right. When we recommend these vaccines, it is to reduce your risk, and they reduce your risk of going to the hospital by about half. It doesn't make it zero, unfortunately, and it sounds like you had a bad case. But this would make me even more interested in you getting the updated COVID vaccine this season. The COVID virus has continued to change, which means that you want to have the updated protection that you can. Now, is it perfect? No, it's not. It does reduce your risk of going into the hospital, but you may want to add additional layers of protection beyond just a vaccine. One of them may be, as I was mentioning before, to avoid very crowded environments or when COVID is at a higher level. If you go to those crowded places, to wear a mask, to wash your hands often, when you are, if able to open a window, increase ventilation. Those are all things you may want to add in addition, because it sounds like you've had a bad, experience getting COVID itself, and we don't want to see you sick again. So vaccine is one great way to protect yourself, but making sure you're adding on additional layers of protection, particularly as we get into the winter, are going to be important.
Good advice. And Dr. Cohen, one thing I hear from people from time to time is they're fearful of getting the COVID vaccine because they don't want to get COVID, but there's no live virus in that vaccine, right?
Correct, Bill. There is no live virus in this vaccine. And in fact, these vaccines are training your body to recognize the COVID virus, and so it can act early to protect you. So it's building up your immune system to recognize COVID, to be able to get it out of your body even faster. And I don't want to forget, Bill, and I can remind this to Carol also, if you do get COVID, there's treatment. So it's important to get tested and get tested early, because you have to start that treatment early. So getting a vaccine is a good first step, but if you get sick, please get tested. If you see that it's COVID, then you'll be able to get Paxlovid, but you need to start it right away so that it keeps you out of the hospital. Some people say, oh, I'm not feeling that sick yet. Well, that's the point. We want you to take the medicine before you're very sick. We actually need it to start working to keep you from getting sick. So get tested and get treatment is also a really important tool we all have to be using.
Okay, very good. Let's go back to the phone lines and take another question.
Sure. We have Marie from New Mexico.
Hey, Marie, welcome to our program. Go ahead with your question.
Yes, my question is, are those tests for COVID, the test kits, are they going to be free this year, or are we going to have to buy them? And if so, approximately what do they cost? Because I definitely want to get my husband, and we're both in our 80s, and we will get the shot. We had COVID a couple of years ago, but even though we'd had the shot, but our doctor put us on that Paxlovid, and it made us feel 100% better. But back then, we were getting those test kits free.
For free, that's
right. Are we
right.
going to have to pay for them this year? And if so, approximately what will they cost?
Yeah, Marie, that's a great question. Can you address that, Dr. Cohen?
Yeah, fantastic question, Marie. You can once again order free COVID tests starting at the end of September. So we are going to offer those free COVID tests, not right now, but in preparation for the fall and winter. So stay tuned, and I bet AARP will send a note out about this, but we will reopen covidtest.gov, where you can order those free tests again starting at the end of September. And so if you want tests before that, we do continue to provide some test kits across the country. I would get in touch with a community health center or your public health center, or you could order them online. They're on Amazon right now, about an average of about $5 to $7 per test, if you wanted to just order them right now from Amazon. But they will be free again starting at the end of September. So plan now to get your free test.
Very good. And our excellent staff has come up with a website for our audience. You can get four free tests at covid.gov. covid.gov. And as Dr. Cohen said, that starts at the end of September. And keep an eye on AARP's website for more information about that. Thank you for all those questions. We'll take more questions in just a moment. If you'd like to ask a question, press *3 in your telephone keypad. Dr. Cohen, let me turn back to you for just a moment. We've seen some really interesting recent studies come out. I want to ask you about two recent large-scale studies suggest that shingles vaccine may reduce dementia risk. What have you learned about that?
Well, that's great. So these recent studies did provide some evidence linking the shingles vaccine to the lower risk of dementia. But the bottom line, we do think more research is needed to understand why that link might be there. There are many benefits to receiving the shingles vaccine. About 1 in 3 people in the U.S. will have shingles in their lifetime, and it is painful, and you don't want it. So we recommend at the CDC 2 doses of the shingles vaccine. It's called Shingrix. It can prevent shingles in people who are 50 and older. It's great to hear that it can also contribute to a reduction in dementia, but I would say more research is needed before we're able to confirm that linkage.
All right. Still a promising finding, though. Another promising finding was in the Journal of Nature Communications. It reviewed 46 million adult records in England and it found that heart attacks and strokes were lower in people with COVID vaccines compared with unvaccinated people. And of course, as we've discussed, there's been a narrative that runs counter to this. Some folks saying, oh, COVID vaccines are harmful. What can we glean from these findings?
Yeah, these findings are important, and it reminds us that getting the COVID virus has serious consequences for older adults. COVID has been associated with increased risks of stroke and blood clot and heart from getting COVID itself. And so when you get a vaccine, you're reducing your chances of getting COVID and reducing your risk of getting things like long COVID. So it's not surprising that our research is showing that getting vaccinated is found to lower heart attacks and stroke. So while we continue to encourage folks to get vaccinated, in January of this year, we published data showing that the vaccines help protect adults 65 and older, particularly adults on dialysis related to strokes and blood clots and heart attacks. So we know that vaccines are your best defense against these viruses, and they could save your life.
Okay, Dr. Cohen. We have touched on flu, RSV, and COVID in this program. Last month, the CDC issued a broad warning about another seasonal respiratory virus, this one called parvovirus. What is parvovirus, and what should older adults know about it?
Yes, there are a lot of germs that circulate around in our respiratory virus. Parvovirus is a very contagious virus that is usually mild in people who are otherwise healthy, but we know as we get older that when we have underlying conditions, sometimes mild viruses then can be more serious. Parvovirus generally cause no symptoms or mild illnesses, but if you have weakened immune systems, it can cause flu-like symptoms, rashes, or joint pain. It generally can go away on your own, but treatment is usually something that involves Tylenol or Advil to help with your symptoms. And there's no vaccine for the parvovirus. That's why we want to focus on the vaccines we do have.
Okay.
So make sure you're talking to your doctor about if you think you might have parvovirus, maybe your grandkids have it and you were exposed to it. But my concern continues to be on COVID, flu, and RSV for our older adults. If we're focused on that, we're going to make sure that you are staying out of the hospital and doing well this winter.
Okay, very good. It's now time to address more of your questions with CDC Director Dr. Mandy Cohen. Press star 3 at any time on your telephone keypad to get in the queue to ask your question live. Shani, who do we have on the line now?
Well, Bill, we have some questions online from YouTube as well as on Facebook. So let's go to a few of those. So the first one, let's go to Alicia on YouTube. And she asked, I had a bad reaction to the RSV vaccine. Should I still get the new COVID vaccination and the flu vaccination?
Dr. Cohen?
Thanks, Alicia. Well, these vaccines are prepared differently, and our body can react differently to different vaccines. I would definitely recommend an updated COVID vaccine and updated flu vaccine. You may want to take some Tylenol or some Advil to cut down on any side effects that you may feel from the vaccine. But it sounds like you got your RSV vaccine, so you're done with RSV. We only recommend one dose of that at this time, but I would recommend the updated COVID and flu vaccines.
All right, let's take another question.
Okay, great. There's Trish from Facebook. And Trish asked, how long after having active COVID with quite a sick response do I recommend to wait before getting the new 2024 to 2025 boosters?
Great question. Again, so sorry you had COVID. I would wait 3 months and then get the updated COVID vaccine. I think 3 months still puts you at the early end of the winter season. That will allow you to build up your immunity with the latest vaccine that we have, but 3 months after you've recovered from your last bout of COVID.
And we hear a lot about people who have had COVID having some immunity for a period of time, but that waning over time. How is that true, and how long does that immunity last?
We do know that protection from a past infection or a past vaccine does decrease over time. That's why it's important for us to get these updated vaccines, and for those who have weakened immune systems to potentially even get a second dose of that vaccine. First thing to worry about right now in the September-October timeframe is that first vaccine of the season. Get that now so your body can learn from the vaccine, build up its antibodies. We know that the virus has changed, so you want to get the updated vaccine to protect yourself going into the winter months.
Okay, very good. Shani, let's take another question.
Okay, we have Jordan from Maryland.
Hey, Jordan, welcome to the program. Go ahead with your question.
Thank you. I think my question may have been answered, but I never had a positive result for COVID until about a month ago. I tested positive, but didn't have any symptoms except maybe a runny nose. And I've had the pneumonia, the RSV, and it's another one. But
flu, maybe.
Was wondering when can I get the COVID? It was a month ago that I tested positive at just that one time.
Okay. Go ahead, Dr. Cohen.
Great. Terrific question again. And it sounds like had a mild illness from COVID, probably because of the vaccines and the immunity that you do have. But I would recommend the updated COVID shot in about 2 months. So maybe at the end of October, beginning of November. That still puts you ahead of most of the winter season. But it's 3 months from the last time that you had a positive COVID test.
Okay. Let's take another question, Shani.
Okay. Next we have Kelly from Ohio.
Hey, Kelly. Welcome to our program. Go ahead with your question for Dr. Cohen.
Hey, I just wanted to know, is there a time limit on starting Paxlovid? Because I got conflicting information on that. I went to the urgent care when I was sick for about 3 days, and he said I waited too long. And another person told me I could have had it if it was under 5 days.
Let's ask Dr. Cohen. What are the protocols around Paxlovid?
Thanks for the question. Love that you went to try to get treatment. That is the right thing to do. Get tested, get treatment, particularly if you're over 65. But as you're hearing, you want to get started with that treatment as soon as possible. Day 3 is better than day 5, but day 5 is still okay. So the protocols do say you want to start them as soon as possible. But by day 4 and day 5, they become less effective, but still potential to start those and use those to help you. But day 3 or day 2 would even be better. So the sooner you can start that treatment is the more effective that these medicines become.
Okay, thank goodness for Paxlovid. Let's take another question, Shani.
Okay, our next caller is Mary from Virginia.
Hey, Mary, welcome to our program. Go ahead with your question for Dr. Cohen.
Yes, I would like to know if it's just a bad cold, the flu, or the COVID without taking the COVID test. How do the symptoms differ?
That's a great question, Dr. Cohen. Is it possible to know?
Yeah, great question. Unfortunately, just from symptoms alone, it's really hard to know which is which is why testing is really important, because you want to know what you have. Just because of that last question we got, you want to get treatment. Treatment needs to be started as early as possible, and it could save your life and keep you out of the hospital. So it is really hard to know with just symptoms alone. They have overlapping symptoms, and so it could be confusing. You want to get tested to know what you have. So make sure to think about getting those free COVID tests. If it's not COVID, you want to talk with your doctor or pharmacist about a flu test. They can often run a test that would check for all of those at the same time if you go to a doctor or a pharmacist, but getting tested is important.
Okay. Dr. Cohen, this has been a really informative discussion. I want to thank you for answering our questions and those of our AARP listeners and members today. I also want to thank our AARP members, volunteers, and listeners for participating in this discussion. AARP, a nonprofit, nonpartisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. All of the resources referenced today, including a recording of the Q&A event, can be found at aarp.org/conversations, beginning tomorrow, September 6th. Thank you and have a good day. This concludes our call.